Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hi, this is Dr. Roy Kim. I'm here with Dr. Kristy Hamilton, and we are the Beauty Scientists. It's been some time since we spoke. So, Kristy, what's up with you?
Excited to be back on with you. I know we have so much to talk about. Your trip, the latest trends. We're gearing up for the American Society of Plastic Surgeons meeting. And I feel like the aesthetic landscape is changing more rapidly than ever, especially in surgery right now. So I'm excited to talk to you.
So, one thing that I've definitely learned about and wanted to talk to you about is the Miami Thong Lift. So, you've been talking about this for about a year or so. And of course, we know about thongs, we know about BBLs. How would you define the Miami Thong Lift?
Yeah, so the Miami Thong Lift, it is a surgical procedure, and it's a powerful way to reshape the buttocks without significant visible scarring and without, importantly, adding volume. So obviously, everybody knows about the BBL or the Brazilian butt lift. By definition, with fat transfer to the buttocks, we have to make it bigger, often noticeably bigger, to get that lift. The Miami Thong Lift is different, and it's especially great for women that have sagging in the lower inner quadrant. So if the central lower region of your buttock comes to a point at the bottom instead of a peach, then this is very powerful. If you have sagging over the bottom of the buttock, which we call the inferior gluteal fold, then this is a great technique. And by definition, by rotating that tissue upward and inward, we actually create a volumizing effect at the top of the buttock without adding volume. So it creates that peachier shape, so to speak, and the incisions are all hidden within the gluteal cleft, which is between the cheeks. So that's become a niche procedure in my practice. I actually even was speaking to a different California plastic surgeon over the weekend. So I think we should write it up so our colleagues can benefit from it too, or at least present it. But it's a nice option because not everybody wants a bigger butt, but I find that a lot of patients are seeking a more shapely butt, especially in this post-Ozempic world. So have you been seeing that trend with your patients? Just a lot of sustained weight loss, successful weight loss, and maybe some sagging that wasn't so welcome?
Yes. So patients, even if they lose what I would consider a moderate amount of weight, like, let's say 20 to 30 pounds, to have it come off that quickly is a big deal. And so obviously in the buttock, you can have an okay to good looking buttock, but with loose skin. And it sounds like this allows for fat grafting, technically in the smaller amount, but just given in the right areas to give you a beautiful butt, specifically the Miami Thong Lift.
Yes. And I should add that it can be paired with conservative fat grafting. So a patient does want a little bit more voluptuous hips or something like that, you can certainly do liposuction and add that, just not as much volume as you would for a BBL, for example.
Gotcha. And then what are some of the common misconceptions when you start talking about Miami Thong Lift versus BBL versus other things?
One is that you have to have a bigger buttock. So the Miami Thong Lift it's a solution for that. You don't need to add any additional volume. Two is like when you think of buttock lifts in general, like the traditional ones, we have to make those long incisions on the upper portion of the buttock. And if you have really significant sagging, that still may be the way to go. But a lot of patients don't want that scars not as easily hidden, especially if they don't have a tummy tuck or other visible scars on the body. So this is a very elegant option because the scarring is quite discreet and it's hidden in places that the patient for sure will never see, but perhaps the sexual partner would, but only in very intimate scenarios.
Gotcha. And then when patients come in talking about or requesting the Miami Thong Lift, who is really the ideal patient? And then who do you direct towards maybe more traditional BBL or even total body lift?
What I like to do is in the consultation, I will do the maneuvers that the surgeries essentially mimic. So I will show them what rotating upward and inward, that inner quadrant of the buttock, if they like how that looks and they see enough of a lift effect, then great. If I have to grab the whole buttocks and lift it north to the ceiling, then we start moving into more body lift territory. So it really just comes down to what result the patient's looking for. You're going to get a more powerful lift with a full buttock lift, like a full body lift, perhaps. And then, of course, if anyone's ever saying they want more volume, then we immediately have to talk about injecting fat or alloy or something.
Right. So for those of you out there, for a total body lift, we have to make an incision horizontally all the way across the back. We can, of course, make it look beautiful. We can curve it. But the bottom line is these are reserved for patients who have lost a lot of weight, who have a lot of loose skin. And we're not talking just about the buttock. We're talking about loose skin sort of in the lower back, around the waist, all the way around. And it sounds like the Miami Thong Lift patients really don't have that much loose skin or haven't lost that vast quantity of weight.
Yeah, it has to be a more minor amount, still significant to the patient, but not 150 pounds. And it really is a reshaping. I find even the body lift going, that vector of lift is just straight north, straight up to the head. The Miami Thong, the nice thing about it is because it rotates and tucks that volume up and inward to the cleft, it also rounds out the buttock and gives more projection. So in some ways, it's a nicer buttock shape than you necessarily get with a traditional buttock lift or body lift. So it's also powerful from that perspective. I find with body lifts, it's hard to get that lower inner quadrant lifted all the way you would like. But the Miami Thong, that's exactly where the skin is being removed. And so that always gives that nice like upward inner curvature to the buttock.
Yeah, you and I have critical eyes, and of course we go to plastic surgery conferences. One of the knocks against the total body lift is, hey, it really tightens up the loose skin. It looks okay in pants or clothing, but when you actually look at the buttock long term, it flattens it out. It's not much of a curve in the back at all. It's like a wall that goes just vertical.
Yeah. And so the Miami Thong Lift, I think it's even an option for patients who have had body lifts and reset everything, but want a little bit more of that rounder shape. And I think that those patients are all often very, very thin because they've been on Ozempic or had a gastric sleeve or the like. And so then we compare that with even alloy injections versus that off-the-shelf fat product to add a little bit of conservative volume as well. And that can look really nice.
Yeah. So what is the surgery like? I assume virtually everybody gets it outpatient, along with the recovery, the pain, all those good things.
Yeah, so as outpatient, the surgery it's not a BBL, right? There's no fat transfer, so you can sit on it essentially right away. I tell patients you maybe just want to sit on a regular pillow or a BBL pillow, but it doesn't need to be. And sitting is as soon as you're comfortable with that. So you may feel better lying on your stomach at first, but most patients are back to sitting pretty quickly in the next couple of days. You have to work to keep that area really clean. Obviously, that's an inherently dirtier area where we have bowel movements. So I do like a Steri-Strip Dermabond, like a surgical glue, like Dermabond, almost like cast in that area. And we leave those strips on longer than I normally like to for other body surgeries, just to keep it ultra clean. And I do put all these patients on antibiotics afterwards just to help avoid infections. It's an inherently contaminated area.
That makes sense. I think the other thing too is what are the risks involved in patients who have had this procedure, like right afterwards while they're healing?
Yeah, we're watching them for fluid accumulation or seroma. So you can consider using drains. I put all patients in compression to try to avoid drains unless it's a really big lift. And then, of course, infection just because of where the incisions are. So they're right next to the perianal area. So the patients have to be really good about taking frequent showers and keeping everything as clean as possible.
Yeah. So also it sounds like the best candidates are they're more technical candidates for this procedure because let's face it, everybody's going to have saggy, loose skin eventually, maybe as we get older.
Yeah, all of us, I mean, if we all live long enough, it becomes a surgical candidate for everything, I suppose.
That's true.
So, but yeah, I think we've just been seeing more and more of it because people have been so successful with weight loss. And I think like 3 places patients generally don't like to see is like 1, their face, 2, often their breast, and 3rd is the buttock. Usually people really don't mind having like smaller arms, smaller waist, smaller legs. It's like, that's all okay. But you take it from the butt, the breast, or the face, and all of a sudden patients are like, wait, this is not what I wanted.
Yeah. And even if you're one of those patients that didn't really care beforehand, once you're developing loose skin over those areas, you really start to notice it.
Yeah. A lot of my patients will say that when they're standing in the mirror, they can even see the inner sag of the buttock from the front. And they really don't like that. Like, it gives them the ick factor, and they just like, they don't want to feel their buttock on the back of their thigh. It bothers them. And all these patients, they've been like very fit, very active individuals, and they feel like it just doesn't line up with their athletic, active lifestyle and aesthetic.
Yeah, that totally makes sense if you have that much loose skin. I mean, a lot of people want something done.
Yes.
Is there anything else you wanted to add about the Miami Thong Lift?
I have now done it under local as well, although with the caveat, this patient had a bad experience with general anesthesia and just it wasn't on the table for her. So we just agreed we would go for a more conservative result and possibly even have to do the procedure twice, like almost in a staged fashion to get her to lift. But we were actually able to do it, and she had a successful result. And I don't think we're going to go back to do it a second time. So if you're feeling a little bit more adventurous, it's not as powerful as surgery done awake, but it's possibly can be done. Although I still greatly prefer doing it under general anesthesia.
Well, yeah, but in theory, you could do the whole thing under local, assuming you get the right patient and maybe not quite as much loose skin is my guess.
Yeah, not as much loose skin just because I wasn't able to undermine. I normally like to dissect down to the fold to really mobilize that tissue and rotate it upwards. And for her, I could get about halfway there. And then we just have to stop.
Right. Well, new frontiers. I mean, this is
very exciting. It's a great little operation, and it's great to have another tool in the arsenal, so to speak.
Yeah, definitely. And if we can actually tighten loose skin in that area, but not make a total horizontal incision all the way across the back and give shape so it's not just flat up and down. I mean, that's awesome.
I think so too. Improve cellulite as well, because you're cutting all those bands.
Yeah, that's right. Well, fantastic. Thanks so much for talking about this procedure. And I am excited to learn more about it. And yes, we should definitely write that paper.
Stay beautiful, right?
Stay beautiful. Thanks so much for joining us. And out there, if you are listening to us on audio, please fire away with any comments and questions. And if you're on video, leave us some comments about what you want us to discuss next time. Thanks so much for joining.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.